You can insult me all you want. As a person, you can insult my personality. You can even slap me on my left cheek. As a good Christian, I will turn my right cheek to you to slap. Do you get? But when it comes to my profession, I can protect it with the last pint of blood in me. You know that I opened this channel initially. I just wanted to portray pharmacy. I wanted to portray my profession to the world. If not because the thing was not working as I planned, I changed my name from Health Talk with Farm B to my main name. Do you get? So that I can diversify kind of. But when somebody now comes and tries to bring down pharmacists, you're trying to demean us, you're trying to make us almost irrelevant, I will come and talk my own truth. And that is it. You see, a couple of weeks ago, Vicky's Corner, she shared on her main channel how somebody went to the pharmacy to get injection, a big YouTuber, I can't remember the name now, maybe NeloOkeke or something, that she went to the pharmacy, she took her son to the pharmacy and they were giving the son injection. I came out, I dropped my comments that it was wrong. But come think of it, there are some pharmacies that are certified to give injections. Now, she opened 5 months ago, about 5 months ago, she started a health channel, but she did not portray it to the world. But recently, she shared the link to her healthcare channel, and I went there. That's Health Talk with Vicky. And I watched that video where she shared why you keep having recurrent infection. And then she was throwing jabs at pharmacists again, like almost bringing us to nothing. And me, I will not take that one. I won't take that. If you have not seen her video, go and see the video. She said that if you have infection, that you should not go to the pharmacy, that you should go to the hospital and see doctor. Yeah, I agree. This healthcare system is a multi-professional one. It's a teamwork. And everybody is important. The one that is paining me is that she's making us seem like we're useless. Now, imagine a world where there are no pharmacists. Imagine a world where the people you have to see whenever you are sick with any kind of ailment is a doctor. Imagine that you have cough, you need to go to the hospital to see a doctor first. Imagine you have malaria, you have to see a doctor. The slightest ailment, you just have to see a doctor. Please, are doctors not humans too? Now, even in developed world, in the UK, in the US, we now have what is called independent pharmacist prescribers. Like, we have pharmacists that have been given certifications, that have been licensed to prescribe drugs, like to treat some minor infections, including urinary tract infections, including the vaginosis, the yeast infections that Vicky was talking about in her video. So imagine a world where there are no pharmacists, there are no nurses. Come off it. You can say that people should practice right. We have community pharmacists. They are the first point of contact to patients when it comes to community health. Community pharmacists are not just figureheads to be dispensing drugs. No. Come on. We also took anatomy and physiology class. So 1 year anatomy, 1 year physiology. Are you saying all those our knowledge are irrelevant? Remember, pharmacists are custodians of drugs. There is no way you will go to a doctor. Don't mind the dogs. There's no way you will go to a doctor. That the doctor will now come and do abracadabra and heal you. Of course, the doctor is still going to prescribe drugs. Now, who manufactured the drugs? Are they not pharmacists? You don't have to try to pull somebody down in order to elevate another. No, I don't like it. I don't agree with you. We have pharmacists that are working in collaboration with medical lab scientists. In my years in community practice, we had lab scientists that would come down to the pharmacy to give us prescriptions. We also write for patients to go and do MCS, to go and do HVS. And we can read these simple results. The results are very simple. You can read, you can see, okay, the bacteria is sensitive to this one, is not sensitive to this drug. And based on the results, we can also prescribe. It's not as if we are completely useless, so Vicky. I don't think that we are completely irrelevant in the healthcare system. This is a multi-professional teamwork. In hospital practice, you can say that, okay, you need to see a doctor. We don't even go out of our way to want to treat patients in the hospital. You have to follow the bureaucracy. I mean, what is it called now? You have to first see a doctor, you see the lab people, we are the last point of contact when it comes to the hospital practice. But in the community, we are the first to. There are some things you first give first aid before they take that person to the hospital. And mind you, we also refer. It's not as if we are Mr. Know-all. Nobody knows, or even doctors sometimes they make mistakes that we have to vet prescriptions and write back to them to correct their mistakes. So please, in your subsequent videos, Vicky, try to be diplomatic. Vicky is my friend, it's not as if we are fighting. We are not fighting. But please try to be diplomatic. This is me trying to protect the image of my profession. Eh? Because people will come and watch your video now. You know you're a big YouTuber. People will come and watch your video now. And they will start looking down on pharmacists. They will go to the community pharmacists now and start looking down on us like, what do you know? Please, we know a lot. In the UK and the US now, they are giving them license, pharmacists, to be prescribing. Like they can treat minor ailments, including urinary tract infections. So what are we talking about? So basically, that is what I came out to clear. Vicky, please, in your subsequent videos, know how to address it. Don't just keep throwing jabs at pharmacists. You are not irrelevant. You may say that they should not give injections. There are some pharmacies that are certified to give injections. Even some of them are certified to give family planning, like to give contraceptives. Shebi, even overseas, you travel to the UK now, you don't have caring, what's it called? You don't have carers experience. You don't have any experience. You're not even a science student. You don't have any science background. But you get there, you can still get a job as a carer. You can become a senior carer when you get some certifications. You are not a teacher. You can get to the US now. You take some courses, some certification courses, and then you start your crèche. I mean, what do they call it over there? So it's not that deep. You get. So let me make this video too long. Thank you so much for watching. I hope to see you in my next video.